The Nature Podcast is sponsored by NPG Language Editing, a high-quality English language editing service from the publishers of Nature.
Stem cells have had scientists excited because they have the ability to become any cell in the body. More recently introduced were iPS cells, adult cells that can be reprogrammed back to a primitive stem cell-like state. This is achieved by bathing these cells in chemicals called transcription factors, which instruct the cells to reprogram into different cell types. Now a Canadian team have managed to convert skin cells straight into early blood cells, completely bypassing the reprogramming step. How exactly? I spoke to Mick Bhatia.
We certainly capitalized on a lot of work done previously on with human skin fibroblasts. I think, as we said, the induced pluripotent stem cell demonstration showed that those cells had potentials beyond just remaining as skin. And what we were really interested in is what mature cells we could make for the purposes of cell replacement therapies in regenerative medicine. And our approach was to look specifically at blood as an area of example. There's a lot known about the blood system, and it's already used clinically in terms of bone marrow transplants and transfusion medicine. So we thought if we were starting on the human, that was a good choice, a lineage to look at.
So what did you do to these cells? You added some sort of concoction?
We did, yeah. It took certainly a lot of trial and error. We were very interested in how the reprogramming process actually takes place when you're reprogramming them to IPS state. And one of the things that we realized that there might be other potentials that one starts to see before you generate an IPS, that other cells might emerge. But the conditions that those skin cells were grown in were specific to retaining a pluripotent cell. So what we wanted to know was the factors that had been worked out already with IPS, transcription factors specifically. Was there a specific transcription factor combined with growth factors, proteins that could be added to the Petri dish, that might allow us to select and differentiate or convert, as we've now coined it, to another lineage? And we basically did trial and error, working on a combination of timing, when we added the hematopoietic growth factors, and which specific transcription factor was to be added. And we ended up identifying one that worked, which was an OCT protein that had to be put into these skin cells in combination with a very specific timing of when we add hematopoietic growth factors that allowed us to demonstrate that the fibroblasts had the ability to produce blood progenitors.
This mixture, this OCT protein that you added to the cells,
when we put in OCT and you combine it with the hematopoietic growth factors, it actually would turn on and off unique genes that were specific to blood generation. In the absence of those growth factors, it actually did something very different. So it seems like you could externally regulate what OCT was doing in the cell by providing or bathing the cell with different proteins. It wasn't just the factor that you used, the transcription factor that you put in. It had to be put in a cell that was treated in a different way, because that cell receives signals, and then it allows OCT to do different things in it. And I think it's that combination. Well, we show that it was that combination that actually allowed the conversion to take place. Right. And that hadn't been done before. OCT had been used to make induced pluripotent cells, but those cells were always cultured in vitro under conditions that were trying to find a pluripotent cell. And OCT never worked on its own. It would to have an induced pluripotent stem cell, you had to have OCT with other transcription factors. So it sort of needed assistance to help it reprogram cells to a pluripotent state.
OCT almost drives the transformation, whereas the other transcription factors and the specific proteins that you mix with it direct which way it goes.
Exactly.
So, you added this mixture and you started off with skin cells, and tell us about the blood cells that you created. How do they shape up to healthy adult blood cells?
Yeah, so we realized that we could make these mature blood cells of specific types. So we could make neutrophils, which operate to opsonize bacteria, macrophage, which engulf foreign particles in the body. We also made red blood cells and another cell type called a megakaryocyte, which makes platelets, which is essential for coagulation of blood and wound healing. So all of those cell types could be generated, but we could also generate a progenitor of those cells. So it isn't a cell that's fully differentiated yet. It retains some ability to duplicate and proliferate before it successfully turns into a cell that functions in the body. And we felt that was a benefit because it allowed us to grow the cells in larger quantities prior to terminal differentiation. It turned out that the red blood cells we produced from these adult skin samples was actually adult blood, and so they actually express adult hemoglobin, which is quite different than the red blood cells that one can generate from either human ES or human IPS. They normally, because they feel they're in an embryonic state, when they differentiate, they produce fetal hemoglobin, which isn't as useful if you're transplanting or envisioning transplantation into adults.
Why does that make these cells more useful then? What are their clinical applications?
Absolutely. I think the fetal and embryonic, they can certainly do the job, those hemoglobins, but they actually do it too effectively. They actually have almost a 70 times higher affinity for oxygen. And that's not the kind of cell you want to transplant into a person because the oxygen requirements would be too high.
So theoretically, in the future, a patient could come in with a need for blood and could therefore use some of his or her own skin cells to grow their own blood.
Yeah, absolutely. And the fact that we can use their skin cells means there's no risk of rejection when transplanting those blood cells back in. And in our hands, at least, the process is also more efficient than generating blood from either ES or IPS, in addition to the third benefit, which is you're generating adult cells. So those are the kinds of things in the future we're going to be optimizing and working on, even to the point of seeing if we can freeze and thaw the blood cells we generate so that we have a storage of these cells should patients require them. And the nice thing there is there are already blood banks that have developed some of the cryopreservation technology required.
I mean, presumably you can't grow your own blood in 10 minutes, so you can't come in with a horrible trauma and grow your own blood there. So, could you just give us a sense of a situation when this would be really useful?
Yeah, certainly. I think in the acute case that you mentioned, we envision taking skin cells from different healthy donors that are of different blood types, for example, B positive, O negative, generate those cells, and we're hoping we can actually cryopreserve them. So in the cases you indicated earlier where there's an emergency, a trauma, where there's a direct need for transfusion, one could use storage of skin-derived blood cells as a possibility. The other application that we are thinking a lot about is using this for patients, for example, with leukemia, where there's a genetic alteration in their blood that makes their blood cancerous. By taking their skin cells, which do not have that genetic mutation, and generating these blood cells, we provide an alternative source that could replace some of those leukemic cells. And we think it would add to the current therapy that they go under. So you'd certainly envision a requirement for chemotherapy, but one of the problems with chemotherapy is it kills off highly growing proliferative cells, which includes the blood. So you always need an alternative source. And because the therapy is usually strategized as to when it's going to start, there would be sufficient times to prepare skin samples that could be converted that could be used in those types of patients.
That was Mick Bhatia of McMaster University in Canada.